Happy New Year.
Happy New
Michelle,
Year.
can you believe that in 2025 we did 18 episodes exploring different frequencies of filming?
That's a lot. And what's going to happen in 26 is even better.
Hi everyone, I'm Kayla, and welcome back to Rock the World with Kay and Michelle. Today, we're talking about living with chronic illness and immune system conditions, what they are, how they affect children and families, and why awareness and advocacy are so important. Before we start, a quick note. This episode is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. And if you notice any pauses during this episode, we ask you to keep listening. Sometimes, someone's processing their thoughts, or it's just part of the natural flow of conversation.
Hi, I'm Michelle Turner. I'm movement lesson, but I'm also a mom with a son with chronic illnesses. Um, my son is polysaccharide AB deficient. He has no immune system to bacteria, also known as SAD. Um, he gets IVIG on a weekly basis. We do subcutaneous. We've done it all. We've done IV. We've done IV with port access. We've had massive infections from Haemophilus influenza to staph. That was his original one. He was vaccinated. This is not a vaccine injury conversation, but he was vaccinated with Haemophilus influenza. And instead of developing the titers at 13 months, he developed the infection. And then they didn't find the infection that was sitting in his skull for 3 years, despite hospitalizations with preseptal cellulitis. We've had sepsis. So people see my son now at just he's turning 23 in 5 days on the 14th. And people think that he's fine now or just has autism now. But if my son doesn't get his medication, he will probably.
Wow, crazy how.
I know. So and thank goodness they said he'd never walk or talk, and thank goodness he can walk and talk, because not only does he graduate from ASU with honors, but he is 6'3", so I do appreciate that in his case he can walk, because a male child with special needs, which we can probably even do a great podcast on, are different than a female child with special needs.
Yeah.
Different responses to hormones and biological
Yeah.
factors, height, growth. So, but that's another great podcast to wait for, because it is a concern what to do for my daughter, what to do for my son. And
Wow, crazy how it took 3 years.
oh, not only 3 years, but my son was in the hospital with preseptal cellulitis. So, one day he woke up, he looked like Rocky. He's sitting there playing with his trains. You don't understand, when you have a child that's so chronic or has a condition, it's normal for them. They don't say, "Hey, I don't have a tummy ache. I don't feel good," or "I think I have a fever." That happens when you have a comparison factor. But when you're so low on the totem pole, and I'm saying this personally about my son, not generalizing. Like at 7, finally, when my son could talk, and I'm like, "You let me know if there's an owie or something hurts." And he looked at me, he goes, "Mom, I hurt every day." And this is still 3 years after starting IVIG and knowing about the infection. My son had surgery and they threw it out. They didn't send his stuff out for pathology. What it took, the surgeries, and we're talking major. My son's had 18 surgeries to the head alone. And they didn't do pathology reports. If I take a tag off my skin and send it, it goes out to the lab.
Totally
So
sad.
it is totally sad. Pun on words, because that's his diagnosis, right? But it just when you have a child that's chronic, first of all, parents aren't expecting this. And because they're just expecting healthy, and my son was healthy and typical, up until 13 months. I actually can show you the pictures. But when I lost him, I lost him. It was very similar to severe trauma.
What is considered chronic?
Chronic has a couple of considerations. Chronic can mean no cure. Chronic can mean it affects your functions of life, and that was probably more so with him. Chronic means that in my son's case, we're very lucky we now have medications that work for him. If those medications were to change or be unavailable, he's instantly in life-threatening or going into pre-surgery. So much so, I am divorced. His father took him off his immune drugs without my knowledge a few years ago. And within 3 weeks, I was ready for emergency surgery, and I'm troubleshooting this, like what's going on, what suddenly happened, and only to find out then because he told my son to lie to me, and he goes, well, maybe because I was taking off my medication, and I was like, what medication? Your allergy meds? Because the immune meds were never in a conversation to be removed from our diet. And chronic can also mean, I hate to say it, financially, because my son's, I'm very fortunate that our state covers these medications, but we're looking at about 40,000 a month US what he needs for his medications. Some places in different states as well as around the world won't cover what my son is being treated with. Um, so chronic can really mean a lot of things depending on, but basically it's really when you feel like you don't have a solution to your problem.
Let's start with the basics. When we say immune system conditions or chronic immune-related illness, what are we actually talking about, especially in infants and young children?
So I'm not a doctor. I'm a war veteran with my sons. And again, when you have a child that's had 30 surgeries and they look at you crying, saying, please, mom, like, can this be the last one? Um, I've been through it that way and trying to find out what was wrong with my son. Um, Immune system, first of all, what you're looking at, most obvious would be fever. However, when you don't have an immune system, there's no fight, there's no fever. So that was the first big safety wall that was bypassed. Well, he doesn't have a fever. He has 22,000 white count. So his white count was 22,000. At the time, I still remember his father in the hallway at the hospital, one of our hospitalizations. And he said, are we going to St. Jude's? And he goes, no, that's more like 30,000, but we're watching for that. You're the flippancy that I heard that you're watching my child for cancer. But again, you have to understand medical processing and life support functioning processing are two different avenues of care. Not that, to say that the doctors weren't doing their job or weren't wrong. It's what my son has is very rare. In his condition, there's about 40 people that I know of, or I don't know him personally, but I mean that I've heard of around the world that have his condition. So it is rare, but unfortunately, with again with what chronic means, when it happens to you, it's 100%. It's not like, no offense, there's a 5% chance of you having cerebral palsy. When it's you, it's 100% chance that you have it. And so that's what you're looking at. So that's where the strain came on my marriage, because I was told, let the doctors do their job and get off the computer, because back then, Google to put in what WBC, white blood kits, and trying to understand these things. You guys are spoiled. What you guys now, you have AI and computers, and I'm typing in basic responses, trying to get back replies. And I said, you let me know when the doctors, he goes, get off the computer and let the doctors do their job. And I'm like, well, you let me know when the doctors are doing their job, again, which is helping me specifically or my son. I'll get off the computer gladly. And so just again, that trying to find out, really to be a self-detective. Um, it was our fourth ear, nose, and throat, because again, we took the adenoids out, and finally it was like, oh, we're gonna know what it is. He came out of surgery and said, that's the worst infection I've ever seen in my life. And I'm like, great, what is it? He didn't send it out for pathology. We were just in the hospital for 11 days on IV antibiotics with the preseptal cellulitis. But I thought, okay, we have the surgery coming up. I'll finally know. And he goes, well, it didn't look bacterial. And this is, again, to answer your question. You're looking at fungal, usually bacterial and viral. Now, there's a very famous movie, Boy in the Bubble. He had no immune system to viruses like the cold, common cold. My son, it's bacteria. So if without his meds, if he got an infected finger, literally he could die. He has no fight for any kind of bacteria, which is pneumococcal bacterias, or, bacterias aren't just, just from dirt and so
Mm.
forth. Those kind of things are different forms of bacteria.
Are there different types or patterns of immune system conditions, and what tends to make symptoms flare or worsen?
There are. First of all, my son will always have his condition. It's in his bones. So in his case, the immune drugs suppress what he has, allows him to manage it, but it didn't cure him of it. Um, I can show you his x-rays, but it- the biggest problem is kids are cute. So the word chronic is sort of visually associated to older people. And
Mm.
so they come in and all a baby has to do is give eye contact. And the doctor will sit there and go, they look good to me. And that's where I was always like, I don't care what someone looks like.
Mm.
I could look great. Right now, I could have cancer and not know it. Until you start doing labs and looking underneath the skin and the hair, you don't know. And so when kids don't present necessarily with special needs or neurological concerns, they're not really thinking that it's a medical concern.
Same with epilepsy.
Yeah. So these things come into play. I'm not looking down and ignoring you. I'm just quickly I can pull them up real quick. Just to show. So here is my son's one of his CAT scans, right? And I'll blow it up. But you can see here in his eye orbits, you see where the black is? All where it's black is infection. So you can see here if I enlarge it, right? The infection is actually in the bones itself, which cause facial structural changes. Again, that chronic system, that infection will always be in the bones. There's very little blood that gets to the bones. I'm lucky that his medications maintain him, but he has a problem. And now another symptom that the problem is with chronic illnesses, guess what? MRI is usually fine. I don't know why your child has development issues because the MRI is fine. And this is where I started more of my movement lesson quest, because for people to say, usually someone that's impaired, no offense to anybody out there, it means abnormalities into the brain. In my son's case, it was abnormalities to the fluid dynamics. Infection is very heavy. So he was always like he couldn't hold his head up because of the weight of the infection was so severe.
This is where many families first start to feel uneasy. What are some early signs parents notice, but may not immediately connect to immune system challenges?
Great question. So this is my son. This is the last picture I had of him before he got sick. Okay. So again, I see dimples. I see the sparkle in his eyes, good, good. He was just starting to cruise and so forth. This is my son 2 days later. So the droop, the drool, the eyes, the sunkenness, he could no longer roll over. He was W sitting there. That's something he never did before. So this is where I'm always about, first of all, know your body as yourself and know who your child. And so even in your case, we've had great episodes with Kay about her epilepsy. So please go back and watch our things. But with epilepsy, let's say you could have a seizure in the middle of the night and have differences. Might be harder for you to transition out of bed, you know what I mean? Or you're more tired. Some kids get or people get very tired after their seizures. They can't function for about 24 hours. There's one case where he started having seizures at 14, and even though he was 28, every time he has a seizure, he goes back to when he's a 14-year-old. And he literally has to redevelop, but it takes him a couple of days now to get back from 14 to 28. So it all happens. So I had a child that was, again, cruising down the hallway, right? And now all of a sudden, he's 6 months later, I can't get him off of the rock. And you can see even with these pictures, you can see abnormality in the eyes, how they're going in different directions, size, shape of the head. So when you know your child, again, his 1 year birthday, he's covered. There's no sensory integration disorder. By 2, we've got severe sensory integration disorder, right? It's like the icing's attacking him. So I made these pictures because I had one doctor said to me, "Oh, well, he was in bad shape actually beforehand. He's not sick. He was always like this. You just didn't notice his development." Even though I wasn't movement lesson yet, I noticed my kid's developing, and I'm like, okay, he was walking yesterday, and today he can't. So I brought the pictures in, starting to show the dynamics of before and after, so doctors would start putting on their thinking caps. So that's when we started looking at actually muscular dystrophies first, because the regression was so severe. He regressed from a 13-month-old level to a 3-month level, in gross motor skills. So there's that. Another thing that I have to look for, and is he doesn't get a fever. But if I touched his forehead and felt the temperature of his skin, and I touched behind his eyes, I could feel the heat. Now, it didn't register on a thermometer, but I can feel so I always used to say, I'm the only one that can tell when my son's getting sick, because I joke around, I can feel him cooking. And I didn't know back then, because that's where the infection was. That's why infection usually is itis. So you can have bronchitis, tennis elbow, in all these things. Anything to do with itis usually means heat. But since he didn't get a fever, I really had to get very hypersensitive. And that's why I think I'm so good at movement lesson, because I can look at somebody from a football field away, not to find fault, but to see that there's something going on.
When was first hospitalized?
Actually, the first ones weren't so much hospitalization. Well, it was because he had needed surgery. That was the first surgery. He suddenly had ear infections. Now he had no pulling, all of that. The crying came later. But no pulling, no nothing. But every time we were at the doctor's, oh, he has an ear infection. Oh, he has a double ear infection. So we were already scheduled for surgery before our pediatrician said, I think we should need to get ear tubes. And we're like, we're getting them next week. So we were pretty aggressive in his care. But that, again, they did ear tubes, but they didn't culture it. So they didn't look at to see what the infection was.
Is it because he didn't know what an ouchie felt like?
Yeah, I mean, when your system is so unresponsive, but also too, imagine, so when he was before he got the immune drugs, his infection, like what I just showed you, literally was this to this. It was all black. There wasn't even an air bubble. I had taken him to the hospital once. He'd been screaming for 2 days. And I still remember the ER doc. And again, I go back like this because that's how they talk to you. Sorry. Ma'am, we don't treat fussy babies. I'm like, I'm not here for fussy. Like, I don't have a splinter. Um, and another example, just to get off my son, I had a client that 7 sets of ear tubes. And she goes, I can't believe we just got ear tubes and he has another infection. But she was always on, they gave her antibiotics from, like, she didn't have to get a script. And I said, stop. I want you to get a culture right now. Don't you dare give him any antibiotics. Get a culture first. He had a yeast infection. They've given him 7 sets of ear tubes for a yeast infection. Well, what grows yeast? Antibiotics. So they were all this time because nobody cultured it because this child with special needs, 7 surgeries, 7 sets of ear tubes, and it was a yeast infection. And I'm not saying this is the doctor's fault, but when a child, especially when they're special needs, but a child still doesn't have a voice yet, again, to explain an owie. So when he's like, oh, does this hurt? They're literally doing this to my son. And he's like, no, because he doesn't have a reference of not hurting to hurt. And they're like, well, he says it doesn't hurt him, so he must be okay. And I'm like, okay, you're trusting a 3-year-old. So can we do a little bit more work? It wasn't until he was 4 that they found the infection and what it was. 3 years.
I want to pause here, because many families don't live in a clear diagnosis, they live in the gray. What is that in between space really like?
Oh, in his case too, I will say a big fault happened because my son was diagnosed with autism. I was fine with the autism diagnosis. I knew he had it. I could deal with it. But I also knew my son was dying. I mean, my son wasn't sick, my son was dying. And so because he now had the autism diagnosis, this really created almost a year and a half of frustration because they insisted that all his problems were autism. And I'm like, guy, and then too, I think they thought they had, what is it, the name called when a parent's trying to make the kid sick? Is it Munchausen's by proxy? I'm sorry that I just don't remember the name. So I think they thought I was looking for a medical reason why my son had autism. And I said, guys, I'm fine with the autism. I can handle it. My son is sick. 2 separate things. And they lumped it. Just where I think they do that with cerebral palsy, they might see an infant spasm versus epilepsy. They're not looking correctly. I know it's difficult. I'm not saying it's easy. But sometimes you have to put on a thinking cap with a child, especially if they're chronic and you don't know it.
Why did they think it was related to autism?
I don't know. How do you have a high 22,000 white count and it's autism? I just think they didn't know, so they just were lumping it. But um, they're not thinking it. When I tell people that my son he still has Haemophilus influenza, most people look at me and say that's not possible. And I'm like, go look at his lab reports. I'm not making this up. Polysaccharide AB deficient. I had a doctor once say, did someone actually diagnose him with it? And I'm like, there's not even a group on Facebook. It's so rare. Like I didn't Google diagnose my child. So, he can't get vaccines because of the bacteria factor. A lot of people too say, oh, he needs vaccines. Actually, the good news is because he gets this immune medicine, which is your blood, he's getting your blood donated and he gets your immune system. He's actually getting your vaccines. He gets your immune system. So my son is actually on his medication, is healthier than he never gets a common cold. He never gets any of those kind of things, knock wood. It's when he doesn't get the medication we're in trouble.
Once families start seeking answers, the diagnostic journey can be long and complicated. What does that often look like?
When you're getting into rare kiddos, I just find you need that one doctor or professional that walks into the room and goes, "Oh, I have a kid just like you. Oh, thank you." And then they put 2 and 2 together real quick. My favorite doctor I couldn't see outside the hospital. This was another, the infectious disease doctor, Dr. Radinsky. He was a gem. He really was. He taught me so much, but he was a hospitalist, so I couldn't see him outside the hospital. He only worked, so I only got to see him when my son was in life-threatening modes, and we got time together in the hospital that way. But he educated me enough. And that's another good thing. If you can find a good doctor, how do I present myself? And present because you have to be within the parameters of someone's listening, their level of listening for the language, medical. This is where we tell people, don't talk about rolling over, talk about that your child is, talk medical, like low tone, these kind of things. If you talk behavioral, they're looking for RSV, not for your developmental movements. And so he taught me how to talk to people. Excuse me.
When families finally have some direction, treatment often becomes part of daily life. What does support and management really look like?
Well, treatment in his case for daily life was surgeries. That was a lot. I love when people say he couldn't have had 13 surgeries. I start naming them and they say they stop. Um, we IV every week. We do subcutaneous. We used to have an IV nurse come in. We'd have to hold him down. He'd be screaming. We had a port to access a 1.25 inch needle, a 22 gauge into a port. A port's about this big on a 4-year-old, you know. Excuse me. And but now I do it every Sunday night. He's on his iPad. He also he suffers from nasal polyps from all of this. So we have to inject him. I do that almost like an EpiPen once a month. And then he's on pretty high doses of allergy meds to maintain, again, the inflammation. He's had about 5 surgeries of sinus endoscopies, and they cauterize the maxillaries and all of that. So his nose can't do the job it needs to for common allergies.
How did you figure out tolerance to do it?
Half of it was just doing what they said. What I didn't realize, like the sub-Q, they don't normally give to infants or toddlers because they think they're going to pull out the lines from we do it on the belly. Sub-Q means it's these little baby needles, are like diabetes needles, and you can put them back of the arm, belly, tush, back of the leg, anywhere where there's fat. And so I put the needles into him in a truncated line, three needles, and it leaches into his, like soaks in. And then that's his immune system. So when you talk about IV, if it's going right into the bloodline, then a nurse has to do it. So it made it much more than less medical. It was mom and dad helping him out. It calmed him down because I finally said, please let me try it once. He was about 7. And it worked out so well, and we've been doing it ever since. But normally they don't suggest that, I think, till age 14. So again, special circumstances, you have to know your child, what's best for them.
How long did it take him to not fight you?
Listen, when it comes to medical, nobody's his best friend. I don't care if it's a parent, you try to explain to a child why they're about to have surgery. I would wait till that morning. I wouldn't even prep. There's no prepping. There's no reason to tell him. He literally will wake up and say, how's your day, mom? And I'm like, sweetheart, you can't eat. And he's like, what? Am I going to the doctors? I'm like, yep. Why? Why even let his mental anguish go there? I'm not trying to keep it from him, but he can't process it properly. He gets really upset, rightly so. I tell medical professionals, don't ask him a bunch of questions because that's where the autism kicks in. If you want him to sit up, say sit up. If you want him to lie down. But when they come in, hi, Graham, what makes you more comfortable? Do you want to lie down and sit up? His anxiety will start hit because he thinks you don't know what you're doing. And so, again, I know my child. I know the system, and I'm just trying to make everybody, because he's 6'3". Let me tell you, when he says I don't want something, he's also a black belt. He's not going to do harm to a person, but he's a moose. Like, they always give him the nurse that's about this big after surgery, and I'm like, seriously? Like, where's the guy? Because again, not to tackle him or hold him down, but it's that guidance.
I meant the weekly meds tolerance.
We're very lucky. He doesn't need any kind of Benadryl or he doesn't have allergic reaction. I think because we've been doing it for so long, we're very lucky. And again, I say lucky. You talk to people that have epilepsy, things like that. Some of them have been on the 15th medication trying to find the right balance for the body. We have a very good balance structure. We're on 25 mLs of Hizentra. It works for him. He really doesn't have side effects from it that we know of. And but if things were to change, you know, insurance wise, capability, what if I'm not here? These are all things to have concerns about.
A lot of what families manage never shows up in a medical chart. What does
Oh,
chronic
no.
illness look like in everyday life?
I know and I've learned it's a relationship between my son and I. Trying to explain all of this, it's great that I have this avenue of the podcast, not to show what I'm going through, but again, hopefully I'm bringing up what a lot of other people go through. But if you don't see it, it sort of doesn't exist to a lot of other people. And to explain that my son could die tomorrow, it's just not a comprehension for most people. Now, I don't walk around saying my son's going to die, but if my son doesn't get his medication, I'm telling you, you'd be talking to me in a hospital room in 3 weeks. That's how severe it is. But now he could live off of antibiotics somewhat, but if the antibiotics will treat that type of bacteria, but since it's in his bones, he would be on IV vancomycin or something like that. And again, you can't do that long term. You're going to lose your hearing. There's complications in other types of medications. So again, we're very, very fortunate that the system right now is working for us. They change the insurance, they change the disability laws, they change, we're always at the mercy of other people when we're at that level of medication.
Yeah.
Yeah.
For families navigating complex medical needs, preparation can feel overwhelming. What does realistic emergency planning look like?
Well, first of all, you have to have a strong stomach. When you're talking 30 surgeries, that alone, a lot of parents are not even emotionally prepared for. They have white coat anxiety, as they call it, much less taking care of their child. So this whole big thing, you have to be strong for your child. Oh, let me tell you, it's beyond that. You have to sit there and go, oh, sweetheart, don't worry about it. Meanwhile, you're going into the bathroom and throwing up because you've just lied to your child. Of course, why shouldn't they worry about it? It's valid, but you're trying to keep down the anxiety. I have learned if we're going to the doctors, I'll tell him. And even though he's 23, I still talk this way. No owies today, meaning we're just going in, saying hello, no labs, no nothing. I'm not sure. There might be some needles involved. You know what I mean? And and I have to tell him that. Now he's good now. He tells people he has medical anxiety, but again, they start being really nice with him and sweet, which is great. I'm not saying, but in his language, that doesn't work. And so I'm like, just do it. And they're like, I don't want to be mean to him. Just, it's not being mean. Just the longer you talk to him, he's starting to squirrel. And or outright, I'll have to tell him it's gonna hurt today. Because we're going in for surgery. And I've learned to be honest, but not too honest with him.
We can't talk about chronic illness without talking about its emotional impact. How does this journey affect families over time?
The biggest thing is money. Again, super thankful to the whole system that my son's meds are covered. There's going to be people right now listening to this just freaking out because they don't have that coverage. State of Arizona works a lot differently than, state of Missouri. Um, there's insurance waiting lists in a lot of states. Some countries, they won't, your kid's not worth it, to give the meds to. And I don't mean to talk that way, but I can give you enough examples. I'm not being callous. These are the laws of the countries. You will see people begging for help for their children because they're in a position where they can't pay for a medication that will save their child's life. Special needs parents, we've discussed it before, have the highest divorce rate, 85%. But, You have to coordinate care, make sure the meds are there. Who's going to do it? A lot of people, again, to give a needle to somebody else, let me tell you, I had to grow up. Um, Knowing too, like who's your best medical team. You have to be able to say, hey, this relationship's not working for me.
Mhm.
I'm going to walk away or find somebody else that can talk to my child, because some medical professionals, as you know, we've discussed it, will talk like you're not even in the room, and or what your concerns are or how you're reacting to a medication. Well, this is what works. So, sorry you don't have good balance and you have migraines from it. You know what I mean? Like, and that might be the only solution, but sometimes there's a better way. Um, and two, time. When your child's in the hospital for 47 days, who's working? Who's maintaining an income? Who's doing all these things? And those come into play as well as when you're trying to tell your boss, sorry, I'm going in for another surgery, and they're literally like, again. I get it that their frustration is, but you're not, it's not like you're going to Disney World. You're going for surgery.
Mm.
And so in most cases, when you have a child who's chronic, someone in the family is not working.
Advocacy becomes a lifelong skill for many families. How does advocacy evolve over time?
Well, first of all, it does take a village when you're in this situation. If you have immediate family, I used to call it my Sunday meetings. You're having dinner on Sunday with everybody. Hey, can I have a minute of everybody's time, please, please, please? Listen, don't say anything to Graham. He's going to have another surgery this week. You know what I mean? Like, I'd let them know. People can't help you if they don't know how to help you. So literally, if I was so exhausted because Graham's infection was so bad, I was only sleeping about every 2 hours because he was just screaming, and I wasn't getting help medically. I love it when they found the infection. One of the first things they said to me was, "Oh, Miss Turner, do you know how much pain he's been in? Seriously, do you know how much pain?" You know what I mean? Go and check my
Mhm.
medical records. Don't talk like that. Um, Tell people, listen, I'm right here. I just need a shower, or I just need to lay down for 15 minutes. I'm right here. I've just changed his diet. You don't have to do anything, but can you watch him? Because when you have a chronic child, again, when they're having a lot of seizures, let's say, you can't leave them alone. Like you don't have, again, some states like Arizona give you nursing, but I didn't get nursing for my son because he didn't warrant it. But again, what is a chronic condition? Are you available to get help? And sometimes you just need 15 minutes, even if it's just to stick your face in a pillow and scream. So, people like to give you advice. I love when I tell people he has no immune system. They're telling me to eat a berry or something like that. I'm like, oh, we're a bit past that. I mean, this isn't, was it euthanasia or so forth? Those might work, but that's not going to help my son. And people mean well. They're not being facetious or anything, but again, half of it is I've spent a lot of time explaining things to people, which is fatiguing to me and takes away my time from my child. And I'm not trying to be rude. And that's why I love these podcasts. But people don't realize what I think someone is going through. And we all need help. We all need help sometimes. It has nothing to do with having a chronic. What we're saying today for our child or our childhood illnesses, what if I had cancer? I would have the same needs, right?
Mhm.
Having, needing support.
As we wrap up, what's the biggest takeaway for parents and professionals listening today?
I'm not trying to say parents always right. But for professionals, please, parents have a language that's different than yours. We didn't go to medical school. However, when we're trying to advocate, which is a good word, but explain what our child is going through, please don't say, don't worry about it. Please just say, well, these are my 3 courses of action I'd like to take. Right now, we're going to stick with here. I'm running these genetics. So they know you're doing something. That we're trying to get the language on the same page. When a parent is scared, they're scared for life support. They're not scared because they don't know. I went in, my son was pre-pneumonia, and I've talked about this before. If he goes to pneumonia, we're now in the hospital for 2 weeks. I don't want to be in the hospital for 2 weeks, and you don't want to see me for 2 weeks. And I came in, I said, my son's pre-pneumonia. Again, they don't like it because they think you're diagnosing. And he's like, well, because it's you, I have to do an x-ray, but he's fine. I don't hear anything. 3 hours later, he comes back and he's pre-pneumonia. And I'm like, listen, look at my files. I'm here for preseptal. I'm here for sepsis. I'm here for pneumonia. I'm not here for splinters and boo-boos. I'm trying to keep my son alive. I need that collaboration of life support. Someone I came in that said I told my son when he was sepsis, they reported him that he was having an allergic reaction for his drugs. I never said that. I never put those things. My son has never had an allergic reaction. So my son, wasn't being treated for sepsis. He was treated, he gave him Benadryl and sent him home. And the next day I was in the hospital now for 6 days for sepsis. And so not everybody's at my level. I get it. But when someone's worried about infant spasms, someone's worried about, I know we can't stop everything and order the EEGs, but at least acknowledge that there's a plan of action. And for parents, too, if you don't feel there's a plan of action, get a second opinion, get a 15th opinion. I've been all through Phoenix, Tucson, San Diego, and National Jewish. And a lot of places I did not get the help that I needed. Next. And I had to do it. So please, even though you think you're going to the best doctor in the world, if they're not managing your care, then there's somebody else that will, and you need to find it. And that's hard to tell people that you're now going to that many different types of doctors. So it is what it is. I'm not saying this is a case for every child out there or for every adult, but you can't mess around with a child's health because it goes chronic real fast.
Michelle, what do you think about discussing goals looking different for children?
Much what we covered today. I'd love to cover in another podcast. Goals for your child. First of all, medical stability, number one. That's it. But your child also has developmental goals, movement goals, school goals. You have relationship goals. This is where I sort of tell people, I know you want to go out on a date, go out on a date. This is not a scheduling meeting. There's times where parents, and I was guilty of this, where you go out and it's like, okay, we have this doctor this week, this therapist this week. You need to regroup and find out why you're still married to begin with, and that's just personal advice. So the goals for your child, knowing where your child is at, but also too, if I feel my child's sick and I'm not getting the same from my partner, it's a problem because now I feel I need to go to the hospital and again, I didn't get that from his dad, but I got it from like my mother, let's say. Oh, you always are overreacting. I don't understand why you're going to the hospital again. And I'm like, it's not the carnival. I used to call the hospital the spa. People go like, where are you at? I'm at the spa, because I was there so much. So goals for a child, it depends on the age. Do you have nursing goals? And it can seem like a lot, but I think we could really tell people how to start organizing their lives and checking off the boxes, and at the same time saying, "Oh, I don't need that. Okay, I don't have to worry about that."
Thank you for joining us on Rock the World with Kay and Michelle. Sharing these conversations helps families feel seen, informed, and supported.
Thanks, guys. Thank you for listening. And if you need help, have questions, please put them in and we'll get to them. See you next week.